Now, the world today suffers from a growing shortage of medical personnel. This gap actually becomes even more apparent during crises and emergencies, highlighting the crucial need for qualified healthcare, technical as well as administrative staff capable of protecting society itself, as well as ensuring the continuity of health services. Now today, given the circumstances and the challenges facing the region itself, we clearly see how the health sector represents the first line of defense during the times of crisis. This underscores the importance of investing in young people as well as introducing them early on to various health professions, not only through theoretical lectures, but also through field visits, direct meetings with specialists, workshops, and practical training. Now, we are very pleased to welcome today Engineer Hussain Alsayegh, the founder of Guide Me 2026 initiative. So how about we welcome you?
Thank you so much for having me in. Hopefully we can spend a little time on shedding light on Wajihni or Guide Me for this year.
Absolutely. Very pleased to have you right here with us on KTV2. Absolutely a pleasure of mine. And of course, Dr. Alsayegh, now in the light of the current circumstances, why has investing in youth as well as healthcare professionals actually become more important more than ever today?
Right. Thank you so much. It's a great pleasure to be here at KTV2. Actually, the demand on healthcare, as you initially said, has grown tremendously because globally the demand on healthcare has increased. The aging population has also made it very clear that we need more professionals, more healthcare facilities. Yeah. So why do we need more healthcare professionals? The reason simply is the quality of life has improved. We're blessed here in Kuwait and in many GCC countries, for example, to have a good level of life standard, including healthcare, of course. So the need for healthcare is increasing. Eventually, we need more staff.
Absolutely.
But we need more qualified staff. Earlier, maybe during 40s, 50s, and maybe 60s in some GCC countries, we used to, have people, immigrants or expats to be here within our country. They have helped us tremendously build our systems and improve the healthcare quality. Now the population of Kuwait and GCC countries has also grown. So the reliance on locals, of course, eventually will even improve.
Absolutely. Now it's not just in demand because of that, but I think especially recently after the COVID has hit, a lot of demands has been hitting, needing for professional help as well as care when it comes down to, having overstems of like the amount of people coming in and out. We definitely do need that, and not just for the locals, also the foreigners themselves. Yeah, absolutely. Now, in your, let's say, the two recent articles, which is the blessing of security and the security of blessing, and crisis, wars, lost opportunities, you actually have discussed not only how the crisis has only revealed the importance of health security, but also the extent of the need for local medical as well as technical personnel. Now, that true resilience lies in building human capital and knowledge. So basically, what is the initiative and its objective in encouraging, let's say, young people in order to pursue health-related?
Right. The two articles were actually written in Arabic, نعمة الأمن وأمن النعمة. So we were blessed again in Kuwait as well as other GCC countries with lots of blessings. Alhamdulillah, the amount of wealth have given us a chance to build and develop our countries. Now, and also build our even society even more. So now in return we should also have a contribution in even developing it more.
In gratitude to
exactly. Now the other article was also in Arabic. It was الكوارث والحروب الفرص الضائعة. So as we all remember, during the Iraqi invasion into Kuwait, tremendous unfortunate incident has happened.
Absolutely.
Everywhere, in energy sector, in education sector, as well as healthcare.
Yeah.
Healthcare facilities were really impacted, demolished, and some of the equipment actually got broken
Destroyed.
down.
Yeah.
I still remember actually an article published in the proceedings of the Radiology Society of North America, which is a very well-known publication about a team from Mayo Clinic who visited Kuwait immediately after the liberation in 1991. And they were actually explaining what they have observed about the quality and the incidents and the demolition on our healthcare facilities. And one of the things that really struck in my mind was their observation about the first MRI that was installed 1 year before the invasion. Unfortunately, what happened at that time is they have noticed that the MRI machine was what we call ramped down, means partially switched off.
Okay.
And the reason is they had no MRI engineer or technician locally. Again, that was the first MRI machine that was almost installed in 1989, 1990, okay? And it was ramped down, which is a loss of the investment on that machine, which probably at that time could have costed 1 million dinar.
Wow.
Okay? And again, we could not use it because there was no local engineer to take care of it. So that idea was in my mind for the last 20 years since I read this article. And I said, we should invest in training our professionals, our youth professionals, who should be able to maintain all the equipment available within borders.
Technical issues, yeah.
So during such disasters, during such crises, such as the invasion, or the unfortunate recent war that we've been into, or even during the epidemic, the first thing that we normally, as a small country, wealthy country with high level of standard, we will immediately feel the disturbance in our supply chain.
Yeah.
Okay? And supply chain does not only mean goods, assets, or material, or medicines, or even equipment. No, that even means the knowledge.
Absolutely.
Workforce,
Yeah.
and professionally trained people.
Exactly.
So just imagine we could have some of the machines, okay, for example, not MRI, because definitely we have lots of good MRI engineers here today in Kuwait, but then we can have something like a proton therapy machine, which is a renowned machine, which usually does not have a local engineer. Can you imagine what will happen?
You can't function basically without that. So what is the use of bringing all of these equipments with all the money that is bought with it, and then not basically training the staff to basically work on these things, or having someone who can actually work on them?
And by the way, education and training is not a one-time thing. Okay, these are very sophisticated technologies that usually requires continuous training.
Yeah.
Okay. Of course, it has to be compared to the value that, or the value of investment that we put on. Kuwait spends more than 30 million dinar, almost $100 million annually, just to maintain those sophisticated technologies. You can imagine what could happen during a disturbance for any of the, let's say, incidents or disasters that may happen.
That is insane. So imagine that if you could actually have a couple of staff to be trained, them having to have been trained, they are actually able to train the rest of the staff who are coming. That has generations to come, one after another. That is the way that you can actually solve the problem. It just needs a little bit of a push for it. Absolutely. Now, during the brutal invasion of Kuwait, you know, the Kuwaiti healthcare system has played a very heroic role serving the community. We all know that, despite the difficult circumstances that has been going. Now, today with the crises and wars plaguing the region, what are the most inspiring lessons that young people can actually learn from the healthcare?
Again, that lesson learned, you know, was I have interviewed one of the doctors who was practicing medicine during the invasion. Her name is Dr. Nawal Al-Musawi. She's a consultant radiologist. And one of the lessons that she wanted the youth to know about is, do not be confined to whatever you have learned at some point in your time. So during invasion, I myself, I was almost 14 years old at that time, and we had to work in co-op societies, جمعيات تعاونية.
Yeah.
We had to do many things that we've never
Done
you
before.
know, taught to do. Okay, we were really spoiled kids at home. You know, we didn't have video games much at that time, but
It was a beautiful childhood back
exactly,
then, by the way.
exactly. Even though, so we were not really trained on how to. I mean, the most complicated thing was to, you know, put your bed, you know, make it organized
Yeah.
and neat, for example.
Simple things.
Okay, simple things, exactly. So, but during war, we had to do much more. Again, as youth, I was only 14. I still have some videos captured for my elder brothers who were participating in collecting trash, okay, because there was no companies or municipality did not have staff at that time to collect trash, and so on. So in healthcare facilities, I know lots of doctors who had to, let's say, sterilize, clean their equipment. Or even at that time in radiology department, they had something called the dark room where they used to process the X-ray films. Okay, so doctors themselves or people who never had to do it, they had to.
They were forced to do it, and
Exactly.
you never know what comes out of it.
Exactly. Lots of high-ranked people, for example, okay, had to work in graveyards and helping the relatives bury their decents. So
one of the most difficult things.
Exactly, exactly. So the lesson learned, just do not be confined to whatever you learn. You have to keep up, you have to be competent with different skills, be ready, unfortunately, for any next epidemic or even crisis, okay? We have to be ready for it. Inshallah, nothing will happen,
Inshallah,
but then this
no.
is part of life. This is part of life. Actually, rates of epidemic is unfortunately increasing because of the rates of traveling, okay? So it has become very easy today to fly from New York to Kuwait.
Yeah.
From east of Asia till Kuwait. So that easiness of traveling has made it even easier to transfer the epidemics and any outbreaks, unfortunately.
Yeah, I feel like it has a lot to do with what happens around the airports or as soon as you get on the airplane. You know, usually
right.
whenever you get sick, it's on the airplane or it's somewhere in
Yeah.
the bus.
Yeah, exactly.
It's always like that. But now, of course, can you tell us a little bit more about the Guide Me initiative and how basically the idea has basically been originated from?
Right. Actually, the idea came to me because this is our second year, alhamdulillah. In the first year, or just before the first year, the idea came to me because my daughter, who finished her 12th grade, and because she had scored very well, and then she said, I wanted to go to a school of medicine. And then I was really wondering if she really wanted to do this because she loves to be a doctor, or just because she scored high. As you know, many students really target medicine or engineering or even law just because they have scored very high. So I had the following conversation with her. I've been asking her if she really wanted to be a physician who get calls over the night and who has to take care of patients who are sometimes not patient, okay? So is she really serious about it? So I started telling her stories about different types of or specialties of physicians and how different physicians work differently and have work environment that is different. So I started telling her about how a radiologist will work. A radiologist is a physician who did his degree in medicine, okay, and then he has become specialized in reading and interpreting MRI images or CT images.
Yeah.
So usually a radiologist does not touch a patient, okay, except in some rare occasions, such as interventional radiology.
Yeah.
A cardiologist would have his own work environment. However, if you work, and I was talking to her, in ER, then you have to be really good in working under pressure, for example. Or I was telling her, you could go also and be, for example, a lab technologist or a radiology technologist. And this doesn't require, you know, going to school of medicine for 7 years, for example.
Yeah,
you just need to do your bachelor's. Anyway, those stories I had to tell to my daughter, and then I was thinking if it would be possible to tell the other kids in the society the same stories, but instead of telling them in a story way, we could take them to a hospital and see how really an ER physician works on the floor, on the ER floor, or how a radiologist works in a dark room where he could read the MRI images.
They need to definitely see what's going on before they actually, because easy talk, but you know, not really that easy to do. Absolutely. Now, of course, Engineer Hussain Alsayegh, it was a pleasure having you here with us. A great pleasure to see you being here with us, giving us all sorts of information. I definitely learned a lot from you. Thank you so much for being here.
Thank you, Iman, for having me.
Thank you. Now, thanking guest, of course, Engineer Hussain Alsayegh, the Health Technology Consultant. Stay tuned, and we'll be right back shortly after this break.